But yeah, no, thank you. I know the governor wanted to be here firsthand to talk a little bit about this, but given the circumstances, we thought with the Surgeon General and myself, we'd come and make kind of a big announcement today, and really because this comes near and dear and close to my heart. Literally and figuratively, this is something that's affected our family, something that we've unfortunately had to learn a lot about, and I'll tell you, really ever since my cancer diagnosis, the amount of people who have come up to me and have said they know somebody who have been impacted by cancer and what it's done to their family. I can't even begin to tell you the number of people and the heartfelt stories and how we really need to find a cure for this. There's really great innovative treatments out there, I know. I'm learning more every day, but I think we even need to go a little bit further. And I know you guys are on the forefront of that in Florida, really leading the way with a couple other centers. Kind of to give you an idea of how we got here, in 2014, the legislature, as you guys well know, passed some legislation creating the consortium of National Cancer Institute Centers programs. And there were 3 nationally recognized cancer centers that were a part of that collaboration. Obviously, Moffitt is one of them, the University of Miami Sylvester, and the University of Florida Shands Cancer Center, which they're applying for their National Cancer Institute designation. They are the 3rd. And the idea is collaboration, as you well know, communication, outcomes, working together amongst some of the best in the field in the state of Florida to really drive some success for patients. And in the past, the governor has funded this at high levels in his proposed budget. But we are super excited today to be announcing that the governor in his proposed budget is going to be increasing this by 60%. He wants to fund this at $100 million that we want to put forth for cancer research because we want to find a cure for this damn thing. And you guys are on the leading lines of that. And so we're excited to do that today. And again, 60% I think is really saying something about what you guys have done in your fields to lead the way, to earn the right to have this money to be able to do this. And reading some of these statistics about why this money is so important, we looked at the University of Kansas Medical Center. There was a study that they did looking at COVID, and they estimated 9.4 million people during the first year of COVID went without a screening, a preventative screening. For breast cancer, that was somewhere around 90% of the folks who could have had the screenings didn't have the screenings. And we know the earlier detection, obviously, that saves lives. So 2 reasons really why I wanted to be here today. One, wanted to announce this historic funding of $100 million, 60% increase over last year. Then the other part is to really enforce and tell people, man, get out there and get those preventative screenings when you can, as early as you can, when your doctor recommends that you do so, because it can save your life. So I'm just excited to be here, really to help lead the way, to help continue to lead Florida. I know that the Surgeon General probably will echo my statements when he talks about the importance of getting out and getting those screenings early.
Yeah. Well, it's a pleasure to be here with you, First Lady Casey DeSantis, and this is a really important announcement. And it's an important announcement because we know that this type of funding actually does make a difference. So this type of funding supports activities that actually matter and are part of how science in different fields has advanced. So looking at and getting to know more about the programs that are supported by our cancer centers here in Florida. So just over, there were some statistics. So just over these past 3 years, the funding that is already existing has supported about the training of 32,000 clinicians in different stages of their career and scientists in different stages of their career. And of course, that's the leading edge of how we make advances to reduce disease and reduce suffering from cancer. It's also, the funding has also supported care for patients at these centers, and it's also sort of which I say catalyzed about $325 million of overall research funding. So this type of funding is really exactly what we need to do to keep making progress for reducing the burden of disease associated with cancer. So it's wonderful. I mean, this is the formula for reducing illness. And I completely agree with you. It's very clear that one of the things that we've seen over the past 2 years has been a reduction in preventive cancer screening. And as a scientist, I won't bore you all with some of the controversies between in the screenings, because some of the screening is a little bit controversial, but there's some that that definitely has a very strong evidence base, and we know that people have missed screening because of COVID. So encouraging people to get back, particularly people who are high risk, to get back into the doctor's office for screening is a really valuable thing for us to do.
Yeah. No, I agree. And Dr. Hu, we were talking about that earlier, on looking at the declining rates of cancer mortality and how we can get in front of this, and the screenings being one of the most important things. So talk a little bit about what you have seen here at Moffitt as far as people coming in, and then also how these funds hopefully can help you with your mission.
Absolutely. So these funds are going to be extremely important for our mission to prevent and cure cancers. We're at a historic time right now where we know a lot about what causes cancers to grow, how we stimulate the immune system, and for the second year in a row, the deaths from cancer in this country are starting to drop. It's still around the 600,000 level, but they're starting to drop. 45,000 in the state of Florida, starting to drop. We need to drive those to zero, and we think we can by preventing and curing, finding new therapies, and working with the community, trying to implement what we already know, such as screening. We know that there are many kinds of screening, such as screening for lung cancer with CTs. It's very clear that that saves lives, often not done, especially not evenly throughout the community. And so these funds will help us not only apply those screenings, but also train people to do those screenings. That's why we can amplify that effort. You'll see we have some researchers who have benefited from these funds, and you'll see how they have worked throughout the state of Florida in collaboration with other institutions to try to amplify these efforts to prevent and cure disease. Yeah. We're very excited about this.
Yeah, we were talking a little bit earlier, Dr. Permuth, about kind of your work traveling across the state and some of your research projects that you've done. Can you kind of elaborate more on how this has been beneficial?
Absolutely. So funds from the state of Florida were instrumental in allowing us investigators at Moffitt to collaborate with partners at the University of Florida and the University of Miami. And we've been collaborating in the context of pancreatic cancer, which is projected to be the third leading cause of cancer-related deaths in the United States by 2030. And the state of Florida ranks second to California in the number of deaths each year. So via these funds, we were able to start embarking on early detection and prevention efforts throughout those three institutions, but importantly, we were able to expand to additional institutions throughout the state, so 15 total, both community partners and academic centers, all the way up to Tallahassee, all the way down through Miami area, all partnering for the first time to tackle cancer health disparities related to pancreatic cancer. So via these funds, we were able to engage one another and with community partners for the first time to make advancements in the field.
John, I think some people will look to MD Anderson, in Texas is one of the leading places, but more and more I hear people look to places like Moffitt as one of the leading cancer centers. And also, we look at University of Miami Sylvester, they also are the other ones that have the designated National Cancer Institute designation. Yeah. Florida is becoming a place where people come to get results. It seems like that's why you were saying that you're close to an airport, because it's close for people to fly in to be able to get good care.
Yeah, I think what really sets Moffitt apart is the ability to translate its findings into the clinic and to lead first-in-kind clinical trials that become standard of care. So just one of our programs, one of the 5 programs that we rolled out over the last 5 years, had 29 different kinds of trials that led to changes in standard of care that were approved by the FDA, right? And so that really makes meaningful differences. Those are trials that lead to saving lives and to birthdays and seeing my grandkids, and I mean that's what really matters for us. And I think this is really the recruiting hook that we have. So we go head to head with Stanford and Harvard and Sloan Kettering and MD Anderson, and we're recruiting the best and brightest right to Moffitt. And that shows in the success that we had over our last 5 years, getting the highest ranked score that we've ever gotten for our comprehensive cancer center support grant. And so it's really, Moffitt is one of the places to be. And we aspire to become world's leaders in some areas of cancer therapy, like cellular immunotherapies that Dr. Hu is a world-renowned expert in. And so we're going to really move the needle. That's going to be the fourth pillar of therapy that people get, and it's going to lead to cures and really drive down the number of deaths to really make a difference throughout the state.
Until we eradicate this thing, right? We can have all the best treatments in the world and all the care, but the goal at the end of the day is to get rid of it entirely, which we hope what we can do.
Yeah.
And we see so many success rates, as you were saying. Dr. Shafiq, your specialty, lung cancer. So talk a little bit about what you've seen kind of in your profession as far as screenings are concerned, people coming in, not coming in, and then how the funds will help you further help the cause.
Yeah, and thank you so much for your messages about the importance of screening, because in lung cancer, the uptake is nowhere near where it needs to be to really help prevent death from lung cancer. And so these kinds of funds and the support from the state is just going to be very important to really expand the training for interpreting CT scans and lung screening, but to also get access across the state to patients who don't have ready access to a large center like Moffitt does. And so that's of paramount importance. And then additional research support, at least in the clinic setting as well, for lung cancer particularly. In the last 4 or 5 years, all the treatments that we have to offer standard of care all started in the lab somewhere or in an early phase trial and were developed over many years. And so this is really where all that starts, is this kind of support and this kind of funding. So.
Needless to say, the $100 million will be put to good use. And I have to say a little bit about my story. I was always one of those people that thought it'll never happen to me. You always think it happens to somebody else until it does happen to you, and then you're looking at yourself. But my story kind of goes, I went to my OBGYN because I thought something was wrong. I didn't feel anything with breast cancer. I didn't physically feel anything, but internally something was telling me that something wasn't right. My OBGYN at the time, she just told me, she said, well, I don't feel anything. I think you're pretty much good to go. But that kept nagging at me. There was something internal that said, I can't just accept inaction. So I called back. And after a month, I finally got in and got the mammogram screening. And that's when they found it.
Right.
And I'll tell you what, and my doctor said that could have saved your life. Hopefully it did save my life, that you went in. And so when you think that you're out there and you think, oh, this can never happen to me. I'm 40, I'm 41. I should be starting my screenings at 40. Oh, it can happen to you. It can happen to anybody. And you save yourself so much pain and anguish if you go in early and you get those screenings. And you just get a good baseline for where you are, no matter what kind of, whether it's colon cancer or breast cancer or what have you. So I just encourage everybody who's out there, if you find that it's your time, that you're getting up there in years, and you are, your doctor recommends that you go and get it, just go get it. It's an afternoon. It's just, with the kids, find a babysitter, get out the door, get it, get back, and kind of live your life. And so you don't have to spend, you are wonderful people. But I don't know if we want to spend, a summer or a year with you guys. You're wonderful. So any other thoughts, Surgeon General, about just the importance of not only screenings, but just, I think, the importance of this, from the governor's perspective, investing $100 million into Florida, into this kind of research?
I got to tell you, as someone who has mostly spent his career in research and am a proud nerd, which is part of how I got into it, it's really exciting for me to hear about this initiative, because this really is how we pave the way forward to expanding knowledge and improving treatments, improving prevention, improving the strategies we use to address health disparities, which is some of the work that's being done here and at the other cancer institutes in Florida. So I'm so happy about it, and I hope that this type of commitment continues on into the future.
Yeah. I would say anybody else who's battling cancer out there, from a perspective of mine, just never give up, don't quit, just keep fighting. And just because you get some bad news doesn't mean you need to crawl into a hole and a tunnel and pull the wool over your head. You get out and do as much as you humanly can and try to make a difference and do what you know in your heart is right. And so I know there are a lot of people, I've heard a lot of stories of a lot of people who are going through some really tough times, some young moms. And so you're not alone. We're going through this with you. And you've got great people who can offer support.
Yeah, we're the state's cancer center, right?
Yeah.
Made by the state legislature. And we're part of your family, and we're here to help you. And Moffitt is a very large family. And so come be part of our family. We will take care of you.
And I think, is that a good thing to say to a lot of folks who might be a little bit nervous about going to a cancer center because it is a little bit intimidating and you don't want to go down that road, but kind of ease their fears a little?
Absolutely. I think cancer care is so complicated that you really need to go to a place that just does cancer in order to get the best treatments today, and where clinical trials are offered. Often these clinical trials are a chance to get the cutting edge agent that won't be approved by the FDA for a number of years. And so it's really exciting what's going on in research today. And we do think working together we can cut this death rate and get better outcomes. But I think it is important for patients to come to the right place at the first time.
Yeah. All right. Any other thoughts on?
Yeah.
Well, it's tremendous to partner with the University of Miami Sylvester Cancer Center and University of Florida Cancer Center at Shands. Jonathan Licht and Steve Neimer are great partners. We meet every other month and talk about our initiatives and what we need to do together to move the needle for prevention and for cures in cancer. And we're all in on this. And so we thank the state collectively, for really making this experiment really remarkable, right? Yeah. So it's just an amazing initiative.
And besides saving a lot of lives, which this will do with our research, we'll also build a biotech community within the state of Florida. So I really think one day we can build this so economically Florida could be a leader in biotechnology.
Yeah, already leading in so many ways. And with the population influx of a lot of people coming to the state of Florida, a lot of people are going to need some care, unfortunately, but fortunately they'll have a lot of options. Mm-hmm. So thank you all for being here, and thank you for, and hopefully for the media just covering that message of letting people know to get in for their cancer screenings as soon as possible is an important thing. All right. God bless you guys.
God bless.
Thanks. Yeah, thank you.
Any questions? Take any questions?
No, we got it.